morning, Village Square and all the Green Spring. This is Bob Zykowitz, September 13th, a beautiful day outside, and we have a very interesting guest, Dr. Sonya. Bethel, good morning.
Good morning.
And welcome back from your vacation.
Thank you very much. It's good to be back.
Nice to have you here with us. So what updates do you have for us from the medical center?
Okay, well, I would just like to remind everyone that we are now in the fall of the year, and that means that it's also a time when viruses become active. And the one that we can protect against and that we really promote, getting vaccinated against is influenza. And we have really revved up a campaign to get everyone at Green Spring vaccinated. So that includes our residents as well as our staff. So as per usual, we have arranged to have flu clinics, which means that wherever you live on Green Spring, you can pick a site and go and get a flu shot. We have already had 2 clinics already, and what's on the screen, or what will be on the screen, oh, there we are. Tomorrow in Hunter's Crossing in the Cards Room, there will be a flu clinic, and on the 15th in Town Center in the private dining room, a flu clinic. On the 16th in Village Square, and on the 19th in Town Center again. So those are opportunities where you can, really just show up and have a flu shot done. But you can always come to the medical center with a lab appointment, or if you're there for a regular appointment, or even if you're there seeing one of the specialists and you say, I really like to have my flu shot, we can do it.
Speaking for the residents,
yes.
I recall in the past where the flu shots were administered in the conference center or in the medical center. Now you are coming to us. And this is wonderful because there are a lot of people who really can't make it over to the conference center or whatever.
Yeah.
So I certainly approve of the system that you have today.
Yeah, we feel that it is, we're trying to make it as convenient as possible. And then we also go to Garden Ridge and administer flu shots.
Oh, you go over to Garden Ridge too? Oh, I didn't know that.
Yes, indeed. And for the Garden Ridge residents, we're also using that time to administer the new pneumococcal vaccine for those residents who haven't had it. So we're into vaccine season because we do want to keep everyone healthy.
This was a pneumonia shot that you're talking about?
Yes, and I think most people who come to the medical center for their care have done this. It's an extension of the previous pneumonia vaccine. It's called Prevnar, and it covers 13 additional subtypes of pneumococcal bacteria. And you should have that in addition to the original pneumococcal vaccine, which is called Pneumovax. So ask about that when you're getting your flu shot. If you haven't had your update of the pneumonia vaccine, then you can get both.
That is excellent advice, Doctor, and I'm sure that a lot of people are eagerly listening today, and they're going to do what you suggest.
Well, I hope so. That's the whole purpose of doing these, right?
Exactly. What other updates do we have in the medical center?
Okay, well, I would like to announce that we have a new nurse practitioner. In fact, yesterday was her first day with us. Her name is Kimala Roundtree, and she has a military background.
Camilla?
Yes.
Roundtree.
Yes, but nicknamed Kim, so you'll hear us call her Kim, K-I-M. And she is going to be spending some time at Ashby, getting just sort of learning the ropes. But she'll, be with us full time, probably in a week or so. And we're very happy to have her join the team. And I will certainly invite her to, a future Channel 6.
And you just mentioned that she has a military background?
Yeah, absolutely.
Is she retired from the military?
I'm going to wait and let her tell you that herself.
Okay. We won't go any further with that.
Yeah, that's fine. So she'll be joining Village in Motion.
We are still short of personnel, aren't we?
Yes, yes. We've had a difficult season, I would say. say. Starting back in April or so, we had 2 nurse practitioners to leave us within, say, 2 weeks of each other. Then we had one of our docs, Dr. Bala, left in May. And so we've been in the process of trying to recruit and to get new members for the team since that time. When there is an absence from the medical team, our corporate partners are actively involved in the process. And so the initial screening of applicants and initial phone interviews are done with the corporate recruitment team. And after that time, then the recommendations are made, directly to, myself. And then beyond that, if, then the interviews and then more of the process, goes on. But it's a fairly extensive process because, we don't want to, make the wrong decision.
Does an applicant appear before a board of doctors at corporate level and maybe at our level here?
Okay. Well, an applicant does have involvement with, like, the regional medical director, who is Dr. Morris, as well as myself. And then they also come and meet with the doctors who are also a member of the team. So it is, it is a fairly involved process. And it's going to be probably a little bit more challenging trying to fill the MD position that's available because we're going to be looking for someone who can potentially become medical director because I'm in the process of sort of winding down in that position, and I will remain as a staff physician, but will give up some of the.
So you're not leaving.
Correct.
Good. Thank
you. Not leaving. I'll be here. So you might want to know, well, what does that involve, right? What does a medical director?
What does the director do, really, over and above his or her level of competency in the medical field?
Okay. Well, this is one thing that is done. This appearing here on Village in Motion. We are part of the executive team, which involves all the other directors, like the nursing home director and human resources and dining and all of that. We also attend the Health Service Council meetings, okay? We attend the coffee with the executive team. We're there for those meetings. And the medical director traditionally is involved with the hospice program. So those are the major things that are done. And in general, you're supposed to be sort of the health advocate for the community. So in times of let's say a disease outbreak, like if we were to have a flu outbreak or a norovirus outbreak or whatever, then, advice is expected from the medical director.
So the director is also involved in the decision level?
Yes, absolutely.
As and as a member of this executive team?
That's exactly right. Indeed.
So do we have any other announcement that we'd like to make today in reference?
Well, I think I would just again like to remind everyone to please get your flu vaccination. If you don't make it to one of the flu clinics, then please, call and get a time and come into the medical center and get your flu shot, because we want you to have it here so you don't have to go to CVS or, Rite Aid or one of the many places that are also offering the flu shot. We'll have it here. It'll be a part of your medical record, and, we just think that's preferable. And
there's one thing I want to add about the flu shot.
Absolutely.
I got mine, not a flu shot. Yeah, the flu shot. I got mine the other day. And the young lady who administered this thing just put that needle in, and I never knew it was in. She's such a pro. It doesn't hurt, and I had no after effects. I know some people think, oh, your arm is going to just hurt so bad. No, it doesn't. So don't be afraid to come over for a flu shot. They don't hurt. They're administered professionally, and you're always in good hands. Right?
That's perfect. I couldn't have said it better myself.
Thank you. Well, Doctor, I appreciate your coming here today and spending some time with us.
Great.
As we discussed as the director, You're a busy lady.
Absolutely.
In addition to your regular medical duties. Oh, one other thing. As a director, does this include a lot of paperwork?
Oh, absolutely.
Oh,
Yes. A lot of paperwork is involved.
oh, really?
Yes, indeed.
Well, do we have somebody in mind for the new director, or is that up in limbo right now?
Well, I think what is going to happen in the short term is that our regional medical director, who I mentioned, Dr. Tom Morris, he's going to be lending a hand to some of the oversight activities.
Okay.
So his usual office is Ashby Ponds, but he'll be coming here a couple of days a week and, sort of doing some of the administrative duties until such time that we replace that position full term.
Well, Doctor, I appreciate your answering all my questions, and I certainly once again thank you for taking the time out to be here with us.
Okay, you're welcome.
And now we have a little roll-in. May we have that, please?